Have you ever had a small injury, ignore it, and then suddenly it turned into something way bigger? Yeah, most of us have. The problem isn't your body, it's the system. It only reacts when things go wrong. But AI is about to flip that completely, from reactive care to proactive care that actually follows you through your life. This video is about what happens when AI meets musculoskeletal physio. It's about what changes for the clinics, what changes for the therapists, and most importantly, what changes for you. When I was young, I had a very specific dream. I didn't just want to be a physio. I wanted to be a tech physio. I used to picture the patient walking into my clinic, stepping onto a force plate that captures every nuance of how they walk, how they load the joints, where the imbalances are hiding. The cameras help building a real-time skeletal model to understand how you move. At the end of the 6 weeks, not just a handshake and a leaflet with 5 exercises on it, you are given a full report. Here's your movement pattern on day 1, here's how it changed, here's your injury risk profile, here's what to watch for, and you will understand yourself better. And here's the thing, everything I dream about, it's happening. Just faster and stranger and more exciting than I ever imagined. Because it turns out you don't need a patient to come to the technology. Technology can come to the patient wherever they are. It's 10 o'clock on a Tuesday night. His back has been grumbling for 3 weeks. He's been ignoring it, but tonight's bad enough that he can't sleep. He doesn't want to ring his GP at this hour, but picks up his phones and the AI asks him questions. Where exactly is the pain? Does it travel anywhere? Does it change with movement? Any numbness, tingling and weakness? Any changes to his bladder and bowel? Has he had anything like this before? It listens, it processes, and it responds. Based on what it described, this sounds consistent with a mechanical lower back pain, very common in runners with a weekly mileage. The good news, the pattern you are describing has no features that suggest anything serious. Here are 3 things you can do right now that are evidence-based and safe. And here's who you should see and roughly when. This is not a diagnosis, but John goes to bed knowing what he's dealing with, what to do tonight, and what the next step looks like. His anxiety drops, he can sleep better, and is due to see someone in the morning. This is step 0 of the new patient journey. Before the GP, before his physio, before the waiting room. An AI that gives you something safe and useful to do while you wait. And here's where everything changes. Instead of walking out with rest and painkillers, and here's a physio referrer, John is shown a menu with options. Option 1, physio, waiting time approximately 2 weeks, and they have a 80% positive outcomes within 6 weeks. Cost to you a standard NHS referral or 55 per session privately. Option 2, specialist MSK consultant, waiting time approximately 9 months on NHS, faster privately, excellent for complex or surgical cases. But for your presentations, likely to recommend physiotherapy first anyway. Option 3, continue self-management with AI-guided programs, waiting time 0, evidence, mild to moderate mechanical low back pains with no red flags is comparable to early physio in the first 4 weeks. Every contact with the health system should feel like this. Not here's what you're getting, but here is what is available. Here is the evidence, and here's what we recommend, and why. John looks at the menu, he sees a 9-month wait for a specialist, and immediately understands why his GP isn't referring him there. Not because the GP is gatekeeping, but because the data says it wouldn't help him faster. He chooses physio with the AI-guided self-management program running alongside it, so he can start doing something useful today. He walks out that appointment not just with a referrer, he walks out with understanding. And understanding changes everything about how a patient engages with their own recovery. You are understood before you even arrive. John arrives for his first physio appointment. He doesn't fill in paper that has been photocopied 4,000 times. Before he even arrives, The AI has already completed his intake, his running history, his job, his stress levels, his sleep, and the back injury that's been dragging on for weeks. His physio walks in and doesn't start with, "So what brings you in today?" They start with, "I understand you got marathon in the autumn and a golf trip in 6 weeks time. Let's make sure your back pain doesn't slow you down." John almost falls off the cliff because in every previous healthcare interaction, he had to fight to be seen as a whole person, and he has to explain his story over and over again. And now someone already knows, before he's even said a word. John's treatment plan isn't generic, it's built around him. His exercises are front-loaded for the weekends when he has time. They are minimum on Tuesday and Wednesday when he's busy at work. The plan includes notes, do and don'ts that helps offload his back pain. This isn't physio as a service. This is physio as a partnership with your actual life. Now, most people with John's presentation do well. 6 weeks, some hard work, and they are back running. But what if they don't? What if the scan comes back with something more significantly? What if John is one of the unlucky minority whose back pain is actually being driven by something that needs a different conversation? This is where AI does something that no appointment slot has ever been able to do. It shows you the whole picture, not just the next step, the entire journey for people in your exact situations with the exact conditions who have taken different paths. Imagine John is told there's this issue that might need intervention. The AI shows him Path A, conservative rehabilitations. 85% with this presentation avoid surgery with a structured 12-week program, and they return to running in 4 to 5 months. And here's what it looks like week by week. A Path B, injections, reduces symptoms about 60% of cases in the short terms, typically buys about 3 to 6 months of reduced pain, often combined with rehab. And here's what the recovery looks like. A Path C, surgery, reserved for the 15% where conservative management hasn't worked. If you end up here, here's what the journey looks like from day one. Here's what the average person is at 6 weeks, 12 weeks, 6 months. Here's when to be concerned. Here's what normal means at each stage. And crucially, for every path, here is what returning to running looks like. Not just with you might be able to run again, but at what distance, with what strength benchmark you need to hit first. For the first time, the patient journey is not just a passenger in their own healthcare journey. They are informed, they are navigating, they know where they are on the map. For the small number of people, the ones facing a quadricep tendon repair or an ACL reconstruction or a major spinal procedure, this matters even more because those are the people who are most frightened, who are most likely to spiral into worst case scenario thinking, who most need to understand here is where most people are at 8 weeks post operations, here is how far below an average your strength currently is, and that's completely normal. Here's when to worry and when to trust process. Right now, patients piece this together from a patchwork of consultations, YouTube, Googles, leaflets, and now AI gives them a single, honest, personalized picture built from real outcomes data. And this one might be the most important of all. It tells you when to act. For post-op patients, and honestly any patient in recovery, are often unsure. Is this level of swelling normal? Is this pain expected? Should my calf feel like this? For most people, the answer is yes, it's part of the process. But for a small number, those symptoms are the early signs of something serious. DVT and infections or complication that caught early is manageable and caught late is not. An AI-powered recovery companion changes this, not by replacing clinical judgment, but by being the always available, never dismissive first filter. My calf is really swollen and warm 3 days after my knee operation. The AI doesn't say that is normal, rest up. It says
that combination of symptoms, swelling, or 3 days post-op needs to be assessed today. Please contact your surgical team or go to emergency department. Do not wait.
This is not a chatbot being cautious. That is a system built on thousands of cases, recognizing a pattern that saves lives. And it is available at 2 o'clock in the morning. when the surgical ward is closed and you're sitting at home not sure whether you are overreacting. For clinicians, this also means something profound: more time free for the patient who generally needs help. So, John gets better, 6 weeks in, he's back to training, but when he starts loading properly again, his back gets a bit irritated. Not enough to stop, but just enough to notice. That's when the AI check-in picks it up. A few quick questions, 2 minutes, and he spots that things are starting to drift. Gets a message. Looks like your load might be creeping it up a bit, worth a quick check-out with physio before this turns to something bigger. So he goes back. Got assessed with some adjustment to his current plan, and he's back on track without it turning into a full setback. That is the difference between a health system that waits for you to break and one that keeps you whole. This is just the beginning. In the next video, we're going to talk about the how AI will train the next generation of physio, and how it's going to affect the traditional business model of healthcare on its head, because we might be closer than we think to walking into a clinic and being asked one simple question: do you want a robot or a human?